I'm going to let Barb help answer that question, but as she reported earlier, we will have capability at the state level sometime next week, and that should reduce the turnaround time. Do you want to address that, Barb?
Sure. Thanks very much. We only have been sending specimens on down to the CDC when they've been determined to be positive and probable at the Ohio Department of Health. We usually send them down with a 24-hour turnaround time, and they process them when they get them. But again, we'll be doing it at our lab sometime later next week or maybe beginning of the following. We do believe the CDC is getting quite a few specimens from across the United States.
So what are they? So how long, if you were to test someone today, how long will it take for the CDC to tell you whether or not it's a confirmed case?
Well, we'd always start with our laboratory, and if our laboratory found positive and we shipped it down in 24 hours, then maybe in 48 to 72 hours we'd get a positive or a negative back from CDC.
How much shorter will that time be once you're doing that confirmatory testing here in Ohio?
The tests that will be done when a specimen comes will be confirmatory.
Okay. So,
Tammy, would that be helpful for you to explain?
Yes. Tammy works in our state.
Yeah, I'm Dr. Tammy Bannerman. I'm the lab director for the Public Health Laboratory here in Ohio. And it's my understanding that once we get the primer and probe set, which is what we utilize for the assay from CDC, which my understanding they could be coming in at any time now. Once we get that and all the other reagents in place, then we'll be able to do those in-house. And what we expect, we'll do the testing based on the volume of samples that we have. So if we have some probable samples that are waiting to be tested, then hopefully we'll get them done that day. So it shouldn't be more than a 24-hour turnaround time at worst case scenario is my expectation. And as the samples go up, if we get more probables, then we may be doing it more than once a day. But it's going to depend on the volume that we get in.
If you had to hire more lab techs to deal with the potential volume of testing you'll have to do?
No, we have not. You know, we've spent a lot of time doing a lot of cross-training. So we have a lot of staff that's able to do this testing. So we've just been modifying their schedules a little bit, doing some overtime hours, doing some flex hours, doing some more cross-training to make sure that we're able to do the coverage of the weekends, which we hope to be able to do some of that this weekend as well. So no, right now the capacity is fine. We have plenty of staff and instrumentations to take care of it.
The medicine and supplies that you've gotten from the strategic thing, you're talking about distributing them. Is that going to be distributed based on population, based on where these cases show up? How will you make the call of who gets what?
We will let Steve.
Hi, Steve Wagner. I'm Chief of the Office of Health Preparedness for the Ohio Department of Health. So the question I understand is how do we make allocations of the antivirals and the personal protective equipment? Let me just explain by what we mean with personal protective equipment. That's primarily masks, gloves, gowns, eye shields. This is material that's for healthcare workers primarily. Personal protective equipment. I oftentimes refer to it as PPE, and healthcare workers work as well. That was made on really a population basis and allocations to those kinds, with the understanding that those healthcare facilities have a little more of a catchment area than defined by the counties per se, but that's how it's working.
It's been reported that these masks are really giving a false sense of security, that this virus can go right through these masks. They're smaller than the particles. Can you set the record straight on whether or not these masks are actually do work and they can protect people?
Good question. What I think you're referring to is the surgical mask is what comes in for a droplet organism. An N95, which is based on a smaller size organism, is what's used for tuberculosis. Influenza is spread by droplet. The only consideration that might be made if an N95 is needed is based on doing a special test like a bronchoscopy. If you're familiar with that, that's done usually in a separate laboratory room, and it could generate small particles in the process of collecting that specimen. But a surgical mask is adequate for a droplet organism.
So people who are concerned, you're saying you should get masks if you're concerned. you should be wearing these masks?
No, I'm not, I'm sorry,
Okay.
maybe I misunderstood. We are not recommending that people wear masks right now in general. You would wear a mask if you're in contact, like in a hospital, for someone who's isolated. They'd be isolated with droplet organism isolation, so they'd wear a mask. But you and I would not wear a mask in this room or in the grocery store or anything like that.
So for example, let's say paramedics across the state that deal with a wide range of public coming into their ambulances and so forth.
Yes.
In this case, you would recommend it for healthcare workers who are obviously in close contact with the public.
The public in general. What the EMTs do is unique to their policy and procedure. We understand that they are generally choosing N95s because they aren't exactly sure what they're dealing with. If they were going into a patient room in a hospital, they would be wearing a surgical mask. But we have not recommended that EMTs or firefighters wear an N95. But if there's some concern, it's more protection with an N95, but it's more expensive as well. And we could run out.
So for the general public, a dust mask doesn't really do anything.
A dust mask do anything. You're talking about the dust mask, which is the N95. Would it do something? It would definitely do something.
I mean, the typical dust mask that you get at Target or.
That would provide protection, yes.
I'm still a little confused about when quarantine becomes enacted. You were saying someone who's exposed to someone who's a known case
Yes,
is a quarantine case then automatically?
yes.
So if my husband were sick, I'm quarantined for 7 days.
If your husband is determined to have influenza, then even if you were colds and flus, you might get it in your home. But if it is influenza, your husband's diagnosed with influenza, they would want you to quarantine with the full expectation that you're going to come down with influenza.
Right.
They just don't know when, today, tomorrow, the next day. If you're in quarantine, I can move you into isolation.
Okay. Well,
Once you come
the
with
reason I'm
symptoms.
confused is because there are some people who've been exposed to known cases or suspected cases who have been given Tamiflu and they're going about their daily business. They're not in quarantine.
Okay, you're talking about chemoprophylaxis. So if I have been exposed, I have a couple choices.
Okay.
I could be prophylaxed, and that would be give me Tamiflu to hope to head off me coming down with symptoms of influenza.
Mm-hmm.
I may have that choice, but I may not need to be exposed to medication because I might not come down with disease.
Mm-hmm.
So there's several different infectious diseases where chemoprophylaxis is allowed or offered. Meningococcal meningitis is one of them, where if I've been exposed to the oral secretions of someone with meningitis, I could take prophylaxis with the hope that I wouldn't come down with disease,
Mm-hmm.
and I wouldn't be put into quarantine.
Okay. So
Okay.
it's perfectly okay if somebody's had chemoprophylaxis for them to continue working with the public?
Yes,
Okay.
but I would tell you that the local health district is going to want to know right away if they come down with symptoms.
Dr. Jackson, have you heard from any of the local health authorities that they needed to require any of that isolation or quarantine? Yesterday I was told from the public health, hey, it's all been voluntary. Has there been any necessity to say, we have the authority and we're going to make sure you are quarantined or isolated?
First of all, since we are a home rule state, that initial authority would rest with the local health officials. If it is determined by the state that that is inadequate, the state does have the authority to apply that. But it has not been necessary. We have been getting extremely good cooperation with our local partners, and I'm extremely pleased at the level of cooperation that we have been getting. And back to the question of quarantine and isolation, a way that I usually think about it is that the quarantined person is usually well, but may have been exposed, and the isolated person is sick. And that represents that natural thinking piece that I use in my head to help me separate.
Thank you.